Welcome, everyone, and thank you so much for joining the session today on advocacy to improve access to TB preventive therapy in South Africa. Today, we will hear from Goodman Makanda and Pumeza Tesile, who many of you know. They are drug-resistant TB survivors and TB advocacy officers from TB Proof, and they lead the implementation of an advocacy project for the release of the updated TBT guidelines in South Africa, with a goal to ultimately increase access to short course TPT regimens at community level and prevent TB in our communities. This project was funded by Treatment Action Group, and we look forward to hearing from you both. Thank you, Goodman.
Hi, my name is Goodman Makanda. I'm based in South Africa.
Prevention is better than cure.
I'm working
What
for
prevention
TB Proof
for?
as a
Talk
TB
about
advocate.
prevention for tuberculosis
Thank
for
you.
those people that have a close contact at home with someone having TB. So today I'm not presenting alone. I have my colleague Pumeza Tesile. She will be also taking part on this program today. So we talk about TPT. What is TPT? So this program, as I mentioned, is being funded by Treatment Action Group. So the goal of TB Proof to build advocacy capacity among key community and healthcare TPT implementation stakeholders who can raise awareness about TPT, to increase TPT uptake and to advocate for high-level quality short course of TPT for people living with HIV and the contact of people with confirmed pulmonary TB in South Africa, but not only in South Africa only. We're fighting for this to let our high-level meeting and policies to see that we can use this TPT as globally, not for specific areas, but especially if you have a close contact at home, living with someone having TB, and those people having weak immune system. Next slide, please. I have a conflict of interest. As I was mentioning, this was funded by Treatment Action Group. Next slide, please. So I will give you a TB prevention background. TB prevention is a political priority as a high and united high-level meetings on the TB in 2018. South Africa National Strategy Plan to have to people on HIV and TB and STI, aim to increase the coverage of TPT, uptake and expanding as implementation demand for TPT among people with HIV and people living with HIV and TB contacts eligible to also get with an updated TPT guideline release in 2022. So now we will go into objectives. That is, objective one is to increase the key stakeholders' advocacy capacity, knowledge, and demand for access for TPT for high-risk group, including people living with HIV and contact of people with confirmed pulmonary TB and children under the 5 years of age. We developed a context appropriate community healthcare workers TPT pamphlet was in Sesotho and isiXhosa, eligible with the Department of Health with input from TB Proof, core group members, medical doctors, Oriam Institute, and TH Group. We secure ethics permission from University of the Western Cape, as well as a provincial approval. We implement a national TPT social media campaign. We train 20 community in the Cape Town. TPT advocacy workshop with 25 community leaders took place in Hammanskraal. So this was a training happening in both provinces. One was in Hammanskraal, one was in Western Cape with School of Health. So we provide this information to those people, and they were so interested to know more how they can, even for themselves as a community health, to protect themselves, because they are the one visiting, mobilizing in the community, to go in a community to do a household to deliver the medication. all of those things, and they come across with the questions of people. They do want to take TB to prevent themselves, but they don't know the right channel and what kind of medication and how long you get the medication. So it was an interesting session to hold with these people. But for now on, I will hand over to my colleague Pumezatisile, and she will be continuing for the next slide. Thank you very much for listening.
Thank you, Goodman. My name is Pumezatisile. I am an expert TB survivor from Cape Town, South Africa. And just a reminder for everyone that this is a combined presentation from Goodman and myself, and I'll be continuing where Goodman has left. So as Goodman has said, this project was funded by the Treatment Action Group. So with the community healthcare workers, especially in Cape Town, they are from touching nations, and we did a pre and post training questionnaire sort of thing. So which you can see from the correct, which is pre-training and post-training, that the numbers have changed. Like for instance, people have gained experience and they've gained knowledge when it comes to, like for instance, the second question that says once TB has been excluded, TPT will be recommended for, which 60% of those people, which is pre-training, they say people living with HIV, and then post-training, 7% also said people living with HIV. So this shows the numbers. Pre-training, you don't have much information about what you are about to be trained on, and then post-training, people have much more knowledge what they've learned from what we were presenting to them. And that this shows that training knowledge is very, very important. That people, when they go out in their communities, especially the community healthcare workers, because they are the most trusted people, they will know, if someone posed a question, or if people want to know more about the TB preventive therapy, which people don't have this much information, especially in our communities. So this shows that it was very useful that we were able to give them the right information when it comes to TB preventive therapy. And also it shows that people, there are certain people who actually can be recommended for TPT, like people with HIV, the contacts of people who are diagnosed with hormonal TB, and as you can see, also people living with silicosis. Of course, this was also on the pamphlet that I'm going to be showing off on the next slide. So because of technical issues, I was only able to screenshot this part. So TB Proof, we developed a pamphlet for community healthcare workers and also for the community at large. So this was where the training we did with using the pamphlets, obviously, and then they were easy to read. Of course, TB Proof can share this with everyone who's interested to know how the pamphlet worked. So we did an interactive process was applied to develop and finalize the content and graphics for the community healthcare workers and the community pamphlets. So multiple versions, for instance, were circulated with TB Proof members for input and shared with our partners like Oram Institute for One Impact for TB, and also with the Treatment Action Campaign, which is tech agencies based in South Africa. So changes made included, like we aligned with the content with the WHO, which is the World Health Organization guidelines, but the new draft then for the new South African guidelines were different. So we updated content to be aligned with the procedures to roll out TB indications for TB preventive therapy. So we tried to emphasize that for one treatment of health passport disease testing, and before TPT for all, even if asymptomatic, and testing for infection is no longer required. And all people with significant TB exposure, which is those we call TB contacts on this slide, should be offered TB preventive therapy, not only household contacts. So another thing was that people with pulmonary TB are considered contagious, and that there's no need for pathological confirmation or test to do that. So all pregnant women who are exposed to TB preventive therapy, even with even those living with HIV and with a low CD4 count. And yes, we amended it, and we had by now TPT. It was shared, and we, as I said, we if and other people are interested in it, we can obviously share after this meeting. So yes, so this was actually a real life people who actually had TB. Dr. Niels found out. So as you can see from Andrea's quote, that a TB diagnosis can be a big shock, and that her husband had TB. So she encouraged all family members and close contacts to take TB preventive therapy. So only together we can end TB. And I think for one, that is powerful, because being in close contact with someone, and then you obviously end up being a caregiver for someone, and you are at huge risk of contacting TB. Being offered TB preventive therapy will lessen that burden, that it sort of like give you encouragement that yes, you want to help this person, you don't want to expose to TB because you know what TB feels like, so you want to prevent yourself from taking TB. And having this TB preventive therapy will save a lot of people, especially those who are in close contact with someone who actually has TB. So one person, for instance, disagreed that the language used was easy to understand in English. From this, the lesson learned was that for future workshops, it might be appropriate to consider different languages, workshop hosted only in local languages. So for instance, in Cape Town, just to give you an idea, we have isiXhosa, we have Afrikaans, and we have English. So always people speak different language, and some speak all. So it will be best for the next workshop that if you are in an area where people speak Xhosa, we do the training in their own languages, same as Afrikaans and the same as English. So participants identified a need for additional training on other health topics, including cancer, pap smear, breast cancer, drug abuse, diabetes, hypertension, HIV and AIDS, and possibly mainstream schooling. So the group was interested in understanding what TB and TPT is. They asked different questions ranging from how they can refer to the local clinic or identification of potential referrals. What also emerged was the importance of appropriately engaging with the community, as most of them had limited understanding of TB and TB preventive therapy at the beginning of the workshop, as I said, from the pre and post training questions that we posed to them. So yes, and we actually had President of Africa, which is Yvonne Chaka Chaka, who shared a very important message about TB preventive therapy. Again, because of technology, I know I'm young, but for some reason, I don't know how these things work. So this video, it can be shared for everyone after this training. I mean, you can post it on the chat, and people can listen to the Princess of Africa, which is Yvonne Chaka Chaka. So apart from that, we also did a Twitter chat, and we had people like Dr. Sahud, James Malak from the Strategic Partnership, and Petra and Biflo, the artist of music from Music for Change. So I just screenshot these, as I think all just so to note, all presentation is very important, but all Twitter chats and tweets were very important. But I just took this one from Dr. Sau, which reads that we need particular emphasis on TB preventive therapy for contacts, which is for TB contacts. So every TB patient, for instance, was a first contact. We had the tool, which is TB preventive therapy, to prevent TB in the contact, isn't then our failure. So we're trying to bridge that gap, that it was really I think worrying that people didn't know that there's a thing which is preventive therapy, especially those who are in close contact with someone who's trying to get TB. Whether they be their caregiver or they be their healthcare worker, community healthcare worker even. And this shows that there is a huge gap that needs to be filled, that people should be aware that there is TB therapy and that there are guidelines that need to be followed. And these guidelines are outlined clearly on our community pamphlet and also our CHW pamphlet. So yes, thank you for listening. And as I said, this project was funded by the Treatment Action Group, and we have found it that people are actually interested. Although we did one training in Cape Town, also one training in Hammanskraal, which is in Gauteng, we find that there is a need for HWs specifically to be trained on how to deal with such, how to, when they are posed questions from their communities, people want to know more about TB preventive therapy. So there will be future trainings, hopefully, to get more funding, but this is a need, it's really needed in our communities. Yes, so yes, thank you for listening.
Thank you so much, Goodman and Pumeza. I see there's a question in the chat already asking how is the therapy on people who are also living with HIV. Perhaps Pumeza, you could also comment about the awareness about TPT among people with HIV. Apologies from our side here in South Africa. We're struggling with load shedding, so it seems like the speakers just lost their connection. But perhaps we can continue the discussion. So the first question that we had was, how is therapy on people who are also living with HIV? And awareness among people living with HIV, I think, go hand in hand. So I'm not sure, Ruvandi, if you want to share some of your views on this, and then I can also share some perspectives. I was part of that project until we get Pumeza and Goodman back online. I'm sorry, it seems like we have some technical difficulty at the moment. Perhaps what we could do, so they are rejoining our session shortly, but perhaps if it's okay with the group, I just wanted to also mention. Oh, sorry. Over.
Can you hear me? Oh, no.
Here on this technical support, it seems like you're having some issues with the platform. Can you try switching your camera on again and microphone? Thank you.
I did. There's a lot of echo.
There is an echo because maybe you are using, maybe you have opened two Windowses and that's making the echo. Just use one Windows because otherwise it won't be possible. Sorry for the inconvenience.
I did try
Now
that.
it's perfect.
Is
Yeah,
any
now we
better?
can hear you perfectly. Thank you.
Okay.
But we
I'm
just
so
don't see
sorry,
you.
everyone.
No worries.
Okay, I don't know why the camera's not working, but at least for the moment, I'm just going to keep talking if you can hear me. Okay. Still hearing me?
Hear you. Go on.
Okay, I'm so sorry for the technical issues. I don't know if the question was about how is the therapy in terms of what is the rate of uptake in people with HIV. Gwyneth, I don't know if you could clarify in the chat. Generally, there's been a greater focus, I think, on people with HIV. So the rates of uptake are better, but there's certainly still gaps in the TB infection cascade of care in people with HIV. But I think but the contact recommendation has expanded relatively recently. So I think there is more attention and focus on people with HIV, but there are still gaps in that cascade too. And then we have another question. I see, but I'm not sure if Goodman and Pameza can answer that. Because I don't, Pameza may be online. The question is, do you have any practical recommendations for hosting a workshop? For example, the language used or the formats? Pameza, I don't know if you can answer that.
Yes. So, like for instance, with the touching nations, most of the people there didn't, English was not their first language. So, meaning that we held the workshop in English because we thought that was sort of like a comfort language. But then we found that people called us aside to say, like, to ask us to explain something more detailed. Like for instance, like this, one person who actually first language is Xhosa, which is my language too. And then they were like, they don't understand what we just said. Can you please repeat it in English? So that show that people, although we assumed because we thought that it would be helpful for everyone because people speak different languages, but then in future we were like, no, we need to target specific areas that speak that specific language. If it's Afrikaans, then we can have African speakers translate the training in Afrikaans, and also those who are comfortable with English have the training in English and Xhosa. But then it's complex to explain because sometimes when written work is written in, for instance, in Xhosa, it's very hard to understand. But when it's spoken, then it's easier. I'm not sure if I make sense, but we found it out that, especially with so we translated other pamphlets and other information in course, and then we're giving the participant. We're like, no, but can you explain this in the easiest form of the language? Because this Xhosa is like textbook Xhosa, and it doesn't make sense because people do not speak that language. So, yeah, so in future, we learned that, we need to speak, and also everything should be simplified as much as possible, especially when it comes to, like, for instance, TB preventive therapy, because some of the English words, there's no way you can translate it and it can make sense because there's direct translation, and it necessarily doesn't mean what it's supposed to mean because of how people speak and how language sort of like evolves as time goes on. Yeah. So, yeah, I hope I answered your question.
Thank you, Pameza. Any other questions in the? Let me see in the Q&A. I don't see any. And would love to hear experiences from people. I see there are people on community advisory boards and from USAID and others. Let's see if there's any other question in here. Okay, as the updated TPT guidelines were approved in July 2022, one would expect the health workers received an update on this. This is a good question. Was this your experience? Pameza, I don't know if you want to comment on that, about whether health workers received any updates about the TPT guidelines that you're aware of?
It depends what you mean by health workers, because we've been working closely with community health workers, which are like the most forgettable people in our communities because they do not get this such information to start with. So with the community health workers that we work with, it was the first time that they heard about this TPT and guidelines and anything like that, because they knew TPT as something that was given to children if they exposed their mother is as TB, and they had no idea that there are these guidelines in place or that there is anything TB related, because they are the most forgotten people especially in South Africa. They are not considered even as healthcare workers, but it was encouraging for us to be there, also for them to hear what we were able to say about the training and the TPT. And then they were like, they are never included in such things. They don't get email, they don't get SMSs. They're just given bunch of information to absorb, which they have no idea where to start because it's a lot of information. So with this training, they said it's a need for organizations like TB Proof and other, like maybe institutions, to give such training so that they know when they go out in their communities, that they know what TPT is, without having to read it on a book, but actually having real life examples of what TPT is. So in short, no, especially community healthcare workers do not have this much information. And I'm not sure about, for instance, nurses and doctors at clinic, because we haven't worked closely with them specifically for this project. Yeah.
Thanks, Pamela. I think there's a key gap, I think, in terms of making sure health workers are adequately informed and then trained about recent changes in guidelines, and with more to come in terms of regimen changes as well. See if there's any other questions coming up in the chat. One question. Okay, I see something else. 1 second. Oh, okay, great. Question about shorter TPT. So the question is, as we transition to shorter TPT regimens that require less health worker involvement, what do you think are likely to be the greatest barriers to uptake or adherence? I think you're muted, Pamela.
I was asking if you can repeat the question. I cannot see.
The question is, as we transition to shorter TPT regimens that require less health worker involvement, what do you think are likely to be the greatest barriers to uptake and then adherence?
I think, well, speaking as a TB survivor myself, I think you cannot give someone something without explaining what is it for one. So I think the biggest gap will be, as we always say, counseling. Everything you need to know why you're taking this TPT. You need to know what to expect when you take this TPT, like side effects and stuff like that. But some people are just given medication and then that's that. So yeah, I think the barriers, it's maybe the TPT out of stock for some reason, because that happens, especially with also TB medication, or being out of reach for those who actually need it. And also people not actually adhering to treatment because of they do not know, or they are afraid of the side effect that they might get, or just people getting the wrong myths about TB treatment, because that's a thing, because sometimes we like to search stuff, and then we not everything you read, or for instance on Google, is the correct information. So there might be gaps, but I think as a TB survivor, people need to know, as I said, we had community pamphlets, so people need to know that there is something called TB preventive therapy. There are side effects, but then the question is, who besides community healthcare workers, because we only train a certain group of people. What about the rest of South Africa, but the rest of other countries? So there is a gap when people need to know, especially community health workers, so that they can go back to their communities and educate people about this TB preventive therapy and its symptoms and anything similar to that. Yes. You are muted, cannot hear.
Oh, sorry. Thank you so much, Gwyneth, for the comment, Pamela for the response, and then Gwyneth for the comment about wanting to collaborate around TB advocacy. Pamela, building on what you were saying, one thing that came up in one of the sessions yesterday about incipient TB and about predicting TB risk and TB progression from the session yesterday was a group in Malawi had done some really interesting experiment, this technique called discrete choice experiments, where they give people in communities, actually this was people at the health facility, it wasn't in the community, it was at primary healthcare clinics, questionnaires to understand what their preferences are for different testing, for different treatments. And what was interesting is that people didn't necessarily want shorter regimens, but they really wanted as few drugs with limited toxicity. Was the real priority, at least in that setting. And I think they're hoping to do more community-based work. So one thing I was wondering about, Pamela, if you could talk about one of the quick things that came up from Mike Frick from TAG mentioned, one of the things we have to understand is what motivates people to take treatment when they feel well. And I wonder if you have any insights from the workshops, from community health workers or community participants about how we can sort of increase demand in people who don't feel unwell, because that's often a big barrier for TPT.
So for one, so your question is, how do we encourage people to actually, feel
Yeah,
so for one,
feel well.
So as a TB survivor myself, taking medication that will make you sick, that has side effects, it's actually a problem. So there are chances that you won't come back, taking medication. But often what the thing that sort of like supports you to actually go back is the community healthcare workers, because they are the people who are not afraid to go door to door to tell you that you need to come to the clinic and you take you. So they encourage you to do better. And also, there is lack of support when it comes to that, because obviously community health carers can only do so much because they are few, they don't have much resources and anything closer to that. But then they try in their own personal capacity to try to encourage someone to go to the clinic to take their tablets. And because we've been working closely with them at Kylie and the work league, we learn a lot from them, because sometimes we'll accompany them to the houses to take their give people medication. And then there was an issue that sometimes when they visit a man's house, men don't want CHW to be outside their house. They have to take off the jacket that is written, whatever, TB HIV care, whatever, so that they can be as casual as possible to avoid, questions about the community asking, why are you being visited by someone from the clinic? So, of course, there are many issues, but they try so much. So there's a gap when it comes to that. There is counseling, of which, with the other project, with the focus group discussions, counseling is not what we thought it was. Counseling, you think psychology, you think psychiatric, but it's not. But rather, you are just given information on the what is TB and what you might expect when you get tablets from TB. But without, I would say this, with confidence, without CHWs, I don't think many people will come out alive, especially with TB. And then with this TB preventive therapy, they are also needed in our communities because they are the most trusted people. And I can go in a community as a random person, no one will listen to me. But if I go with the CHW who's actually wearing a uniform, then they know that person, they trust that person, then there's a high chance that people will listen to them and take the treatment as the CHW says. And also, obviously, there are doctors and nurses, but they are like the front, they are the most important people, but yet they are so neglected. And of course, we've learned this by, we spend a lot of time with them weekly, and we know they walk, long kilometers to visit a patient because they have seen in their form that someone has missed 2 or 3 appointments. Then it's not even their part of the job, but they, for some reason, it's like they need to do that, although it's not part of their job. So without community healthcare was, especially in Kailicha, and we've seen how they work, we've seen how they interact with people as people, not people because they don't see someone as sick, but they see them as a friend, someone that is a family member, someone that needs help, that they can be able to finish their treatment. So, so in short, just without CHWs having some sort of lead into what's the word, give out this information about TB preventive therapy in communities, people might not even trust it unless it comes from someone that they trust, someone they know from their own communities. So, yeah.
Thank you, Pameza. I think it's a really good point, and would be curious if there's other people in the participant group who come from other countries to comment about the role of community health workers in your setting. Would love to hear that. Got another question in the Q&A. Could Pameza please expand more on the progress of treatment of TBT for people who are living with HIV? And specific question about, are there TB and HIV linked programs?
So I think with the new, correct me if I'm wrong, Ingrid, but with the new South African TPT guidelines is that people living with HIV should also be considered to get TPT regardless of their CD4 count. I think it says something like that, Ingrid. I'm not sure.
Yes, correct, Pumeza.
Yeah. So as we also know that most programs, because you cannot talk about HIV without talking about TB, vice versa. So we try as much as possible to link these two, so that because I think statistics, I'm not sure again, just correct me if I'm wrong, that people who actually didn't get HIV are more likely to get TB. So it makes sense that they get TB preventive therapy.
Yeah, exactly, Pumeza. I don't know whether yes, I think this is a really important point. And one thing that I think is challenging that I'm not sure if we can necessarily answer here is making sure we really exclude active TB disease in people with HIV, because this came up in some of the sessions yesterday about about in countries like South Africa there's a very high prevalence of people with TB who don't have symptoms, and that's high in people with HIV, and excluding active TB disease is very important. So I think that's sort of a relatively newer consideration, and why there are in South Africa the guidelines are really to test anyone with HIV for active TB when they're presenting to facilities now, because we know there's such a high yield. And I think there are linked TB HIV programs, Gwyneth, but I think one challenge, and some of them are run by NGOs, for example, TB HIV Care, who Pumeza was mentioning. But one big challenge is addressing the intersectional stigma, because as Pumeza was saying, TB and HIV clearly go together from a disease risk point of view and risk prevention point of view, but there's also the stigma that goes with the two, both ways. So thanks for that answer, Pumeza. Ingrid asked an interesting question here about, do you think TB survivors and local leaders, like traditional leaders, could help to increase the demand for TBT? What do you think could work, or what is needed? Or do you think the major responsibility to raise awareness about TBT is and should be on the Department of Health? So what do you think is the role of local and community and traditional healers as well?
Mm-hmm. So with the role of traditional leaders, for those who are not from South Africa, so there is a person called a Sangoma, and then when, like for instance, Western medication doesn't work, people usually go to the Sangoma, or they first go to the traditional healer before they go to the clinic. So we've been in talks with the traditional healers, and they want to be involved. They say that they want they call it a window at the clinic, because sometimes they usually, not because of people's beliefs, obvious religious beliefs and whatever, they are not listened when someone say that, no, this person does not need traditional aid, but rather they need Western communication. But then sometimes you find that tests, especially for TB, they are not accurate enough, and then they say that, no, this person doesn't have TB. But a traditional leader will know that this person does not need to take traditional medication. So yes, traditional healers are an important part of community for those who believe in them, and they say that they want to be involved, especially in people's health, because sometimes they find that people stop their medication, hoping that it's not, these diseases like TB, HIV, cancer, etc. And yes, so for one, the traditional healer I talked to said they would like to raise awareness in ways that they might go to a radio station, for instance, and then they will encourage people to go out there to test for TB, for those who were in contact with someone who actually had TB to go take TB preventive therapy. So yes, they are important people in our communities, just as faith leaders are, and any other community leader who's important in the community. And also just so yeah, there was also an issue that Department of Health, for now, they do not recognize traditional leaders, and there are still talks. They are still talking that they get a seat at the table as a traditional leadership or community leadership in a specific role that they do, alongside with the clinics and with the hospitals, and also the public in general. Mm-hmm. Okay.
Hi, Dr. Kansal. Do you have a question? Pamesa, I wonder while we're waiting, thank you so much. Just a comment on the session. Pamesa, I wonder while we're waiting to see if anyone has any last couple of questions. I think you can hear me now. Maybe I wonder if you can talk about how the messaging was developed for the pamphlets and thinking about how to make it engaging and make sure the right amount of information was on it.
So with the pamphlets, obviously we had to get other people's views, like the Treatment Action Campaign, I think the Oram Institute and other organizations. And then they had like valuable feedback for us because, when you do these pamphlets, you usually, do cartoons so that you make it engaging to people. And then all the cartoons at the assumed same race. So we try to make it, a different color people, like white, black, etc. And also, especially when I showed this to the CHWs, they were shocked that there's, like I showed on this presentation, the picture with Andrea and Niels van Delft, that they are healthcare workers, but how can they get TB? I mean, he's a doctor, like anyone who breathes can get TB. That's the whole idea of this awareness, that it's not specific to specific group of people, but rather everyone who breathes can actually get TB. So with the pamphlet, we try to make like the points, like the important points, that who can get TPT, and it's very clear, bold, so that people can be easily to read, and it reads just fast. And they were just a little concerned about it being translated in Xhosa because, when you translate something in other language, it's longer, it's shorter, and sometimes it doesn't make sense, as I mentioned. But we got a really good feedback, especially with the animation that was on the pamphlet, the graphics that were done, and also the picture of a real life doctor and the wife there who actually share the code there. And that was a positive for us.
Any other last questions in the Q&A or the chat? Let's see, I think we got something. Hold on, let me just refresh it. We presume the expectations and responsibilities from local leaders are applied to CAB members as well. Don't know if you want to comment on the role of CABs. It's a shame Goodman isn't able to speak because he has also served as part of the CAB. But I wonder if you wanted to comment about the fact that CABs often include local leaders, Pamesa?
So yes, this is Goodman's perfect question. I mean, he will answer it correctly. But I think, yes, the role of the CAP is very important because they are the ones who actually deal with communities, and they are the ones who actually can help someone, with whatever information they give them. But with TB survivors and traditional leaders, yes, it's possible that they can work hand in hand because as I said, it always comes down to people's belief, but it was refreshing for me to actually talk to a real life traditional healer who actually open to anything clinical wise, and who wanted to know more about TB because they don't have much information about TB. They know that TB is a thing, that there's 6 months of treatment, but they don't have much information from a TB survivor's perspective. So yes, TB survivors and traditional healers can work together, and they can increase the uptake of the TB preventive therapy.
Thank you so much, Pamesa. I can see that we're basically at the end of the session. Huge thanks to Pamesa and Goodman for really nice presentations, and to the group for some nice questions about how we sorry, I've got a noisy baby here. Some nice questions about some nice questions about increasing community engagement and also engaging with local leaders. And look forward to more discussions during the conference and moving forward. Thank you so much.
Thank you, Ruvandi, and Ava, who's loud by your side.
She cares a lot about TPT.